The case we have here, it's 11-month-old neuter female domestic sorghum. It was presented to the local veterinarian for inability to open in the mouth and a malocclusion. There was a history of potential a dog bite when she was a lot younger, which all of these resulted in what we call a malocclusion type 4, as you can see in the reconstruction done by GAIA Biomodels. And you can see how the midline on the maxilla does not align with the midline on the mandible. Furthermore, we see malocclusion related to teeth contacting each other, but the main concern we have in this patient is true ankylosis or intra-articular ankylosis combined with extra-articular ankylosis. So what we see is a fusion between the zygomatic arch, the coronoid process, and part of the coronoid process as well, together with the fossa. So thanks to 3D printing, we were able to use this as a model, as a reference during the surgical procedure. Things we were looking for is, for instance, the direction in which the coronoid process was going, that notch that forms with the temporal fossa, and every single little notch around the zygomatic arch area was really important for us to use as a reference. So the procedure consisted in first performing a zygomectomy, followed by a coronoidectomy and part of the condyle in one segment. Once those two fragments were removed, we proceeded to do fossectomy. So we removed the temporal fossa in its entirety, and what we are trying to achieve with doing those ostectomies is creating what we call a gap arthroplasty. So the patient was initially only able to open the mouth. Well, the mouth was actually locked on 1 centimeter opening because of the malocclusion, and now the cat is able to open up to 4 centimeters, which obviously will improve a lot the quality of life of the patient.